Well, good day. I'm very glad to meet with you again. AFTO's partnership with FDA was well established before I joined the agency in December of 2018. And AFTO members, I realize, have helped shape the rules that are implemented through the Food Safety Modernization Act. And I've personally seen firsthand how you've helped shape the new era of smarter food safety blueprint that outlines our efforts to create a more digital, transparent, and safer food system. I've also seen firsthand how AFTO has been at FDA's side throughout the COVID-19 pandemic. And while we all know the virus that causes COVID-19 is not transmitted by food, we saw how it stressed the food system and certainly affected food workers. The work that we've done together to implement FSMA and to advance the goals of the new era of smarter food safety simply would not be possible without AFTO. Our shared mission is to bend the curve of foodborne illnesses once and for all so that consumers across this nation can live better lives. But before I get into FSMA and New Era, the topics that I want to talk to you today about, I'd like to talk about something that's top of mind, certainly for all of us at FDA, and I suspect many of you, infant formula. We know that this is an issue that causes concern at all levels of government, including states, and I appreciate the opportunity to update you. We also want to express our deepest empathy to parents and caregivers concerned about experiencing challenges in obtaining infant formulas, those brands that they're accustomed to, and they're stressed about it because of their inability to do so. We understand, and more than understand, we empathize with them, as many of us are parents and grandparents too. At FDA, we're working around the clock in partnership with the White House and an all-of-government response to help ensure that parents have access to safe and available infant formula products for their babies. It all began with Chronobacter infections in 4 infants reported to have consumed infant formula produced at an Abbott nutrition facility located in Sturgis, Michigan. Chronobacter may have been contributed to the death of 2 of these cases. It's important to note that Chronobacter Sakazaki is not a reportable disease in this country, in the US, other than in the state of Minnesota. I think a good role model for other states to follow. FDA, along with the Centers for Disease Control and Prevention and our state and local partners, investigated these infant illnesses. At that time, there were 21 infant formula plants that provided infant formula sold throughout the United States. And our investigation focused on products from Abbott Nutrition's Sturgis facility. And concerns raised by FDA's inspection of that facility and environmental monitoring we conducted at that plant. As a result of this investigation and our inspectional findings, the FDA acted swiftly to protect infants, the most vulnerable of consumers among us, as I know you would have wanted us to. And we issued an alert to advise consumers to avoid using or purchasing certain powdered infant formula produced in the Sturgis facility. At the same time, Abbott Nutrition voluntarily recalled several products produced at that facility and voluntarily shut down production, which over time, along with other important factors, has led to a strained infant formula supply chain. And to coordinate a better response, both from a safety standpoint as well as availability, the FDA created an incident management group, which coordinates field activities and compliance actions and seeks mitigation strategies to minimize the impacts of availability for consumers. IMG continues to work closely with internal and external stakeholders to manage the supply chain implications of this infant formula situation. And on Saturday, not too long ago, June 4th, Abbott Sturgis facility resumed productions. And I want to stress with all of you, rest assured that any product shipped from this facility will meet FDA's high food safety standards. Now, during the crisis, I want to share how we've used data, something that we've been talking about for a while now, specifically under the auspices of our 21-4 data analytical platform to analyze the infant formula supply chain. It might surprise some of you, but under law, FDA does not have the authorities to track infant formula production across our country. Nevertheless, during the pandemic, we've tested the limits of our authorities to analyze supply chains because we knew that food supply chain availability and worker safety were two sides of the same coin. And we saw how food systems were stressed during the pandemic. The 21 Forward platform is a tool that was developed and used to track the impact of pandemic-related issues on FDA-regulated facilities in the food supply chain. And in addition to offering support to those facilities, we were able to supply state public health officials coordinating COVID-19 efforts with information and location of the food industry workers in their communities. And today, as we speak, we're using the same platform, 21 Forward, to aggregate and analyze multiple data sets to help monitor the infant formula supply chain and help us focus on areas of greatest needs. We're analyzing high volumes of data, which is enabled because of the scalability of this platform, something you just can't do on a desktop. This in turn has helped guide our discussions with the industry on how to increase production of various types of infant formulas, along with other steps being taken by others in government to support the supply chain and establish mechanisms to streamline the ability for companies to import products under enforcement discretion, White House efforts under Operation Fly Formula. I'm pleased to say that the outlook is getting better all the time. I think we're on a positive trajectory. Production volume is up across most manufacturers. Production volume sales is up compared to the past 4 weeks versus the 4 weeks prior to the recall. Unit sales are dramatically up the past 4 weeks compared to the 4 weeks prior to the recall. So I think we're on a good path for steady state, continued positive trajectory. As you know, the agency has been criticized in its response to the crisis. And our commissioner, Dr. Rob Califf, has acknowledged that the agency was too slow in responding to this crisis and has set in motion an internal investigation of our actions. The bottom line is that we'll do whatever is necessary to help ensure that this doesn't happen again. And the people working on this at FDA are parents and grandparents, as I already stated. So the safety of children is at the heart of our critical mission. Now, let me move on to some of the FSBA and New Era updates I wanted to give you in the brief time we have together. Our work on food traceability continues with the food traceability rule that we proposed in the fall of 2020 and the proposed list of foods that will require the additional record keeping. You've heard me speak about the rule and how it contains two essential concepts: key data elements to standardize the data elements needed for better food traceability and the critical tracking events. We're on track to issue this final rule we anticipate in November of this year. In the event of an outbreak, we know that better traceability will lead to better safety by enabling rapid tracebacks of contaminated foods, speeding recalls, and ultimately leading to better root cause analysis, which will allow us to prevent reoccurrences of similar situations, something that's really important. But the benefits of food traceability go beyond food safety, as we've seen during the pandemic, as we've seen in this infant formula situation. And one of the goals of the New Era Blueprint is to try to ensure that technology solutions that might be used to comply with traceability can scale at low and no cost ways. And so in June of last year, we held a low to no cost traceability challenge. We had 90 submissions from around the world, and we chose 12 winners. And we're working now to make sure that those type of solutions are known and available to firms of all sizes, including small and medium enterprises. Number two, wanted to share another advancement that's happening with FSBA that we're pretty excited about. It was an achievement that we got across the finish line late last year with the December publication of the long-awaited agricultural water requirement. It's always been part of the produce safety rule. This proposed rule that we've issued, if finalized, is going to be nothing short of, I call, a game changer for food safety, knowing that one of our last frontiers in the battle against foodborne disease is produce. Agricultural water, as you know, has been a conduit of pathogens that have caused foodborne illnesses, and this includes water impacted by the presence of animals on lands adjacent to growing fields and water systems. And the proposed rule, in summary, would require farms to conduct comprehensive assessments that would help them identify and mitigate hazards in pre-harvest water used to grow produce. We're evaluating the comments that came through our series of public meetings and that were submitted to the final or to the Federal Register as we work towards a final rule. And we've developed, under the auspices of the new era of smarter food safety, an online ag water assessment builder, an online tool that will help growers assess hazards and mitigate those risks. I know that recall modernization is also something that's important to AFTO, and it's one that the FDA shares, so I wanted to spend a few minutes talking about it. AFTO has called on FDA to explore new approaches to policy and foundational practices for recalls. Your concern is that recalls are being initiated too late to prevent additional illnesses. For voluntary recalls, we rely on companies, I think you know, to initiate them as soon as possible, and that recall is executed to protect public health, and to include FDA in the development of the recall strategy. For recalls initiated based on FDA data, such as from investigational or sampling, we're tracking the days from FDA's awareness to the recall initiation and days of execution. This data is reviewed monthly to assess any gaps in FDA's response. All this is to say, we hear you, I hear you, and we share your concerns. And we're working on this, and we'd like to work on this together. In March, we published a guidance to clarify FDA's expectations for the initiation of voluntary recalls. And a Partnership for Food Protection Work Group is actively working with FDA's Office of Regulatory Affairs, as well as several states, on a pilot program that will be used to develop a framework to enhance recall communication and collaboration between FDA and the states. And in December, FDA released its new era of Smarter Food Safety Blueprint to investigate and improve our response to foodborne outbreaks. The plan is divided into two priority areas that include tech-enabled product traceback and root cause investigations. More rapidly identifying the source of the contaminated product will make recalls faster. And this plan highlights the need for transparency to increase public confidence in our actions. Now, let me close with this. The world around us is changing rapidly. I heard this quote, and I've been repeating it quite a bit over the past few months because it really resonated with me. It said, the pace of change has never been this fast, yet it will never be this slow again. This is true for our work together on food and the food system. The food system is rapidly evolving to meet the changing needs of the consumer and the challenges of our time, to create more resilient food systems, more sustainable food systems. But this is also true, the pace of change is also true for food safety. Our profession in food safety is evolving to meet the challenges too. New tools and data streams and new technologies are going to help us solve some of the most significant food safety challenges that remain, some that I thought we would never solve over the course of my career. And I like to say, if there's one message you take away from this brief conversation, is that better food safety begins and ends with better data, better quality data. Better food safety begins and ends with better data. In the 21st century, we increasingly have the ability to take large volumes of data and big data and convert that into information, predictive and prescriptive information to prevent foodborne illnesses. In the past, there was data, but it wasn't digitized. It was hard converting data into information. There was a big bridge or divide. Now these tools are closing that divide and allowing us to convert data into information. The new era of Smarter Food Safety Blueprint includes multiple goals that involve data sharing. These include expanding our use of information sharing agreements with regulatory and public health partners. One of the ways we've done this is through the domestic mutual reliance agreements with states such as California, Florida, Minnesota, Utah, and Wisconsin. We're exploring methods to create public-private data trust generated by industry that can be used to strengthen analytical work. And the food safety data sharing platform established last year by the trade association Western Growers for the Safety of Fresh Leafy Greens is a good example of what we're talking about. Think about this. The 20th century was often referred to as the industrial age, but the 21st century is the data age. I have to close by saying that there's so much we can do in government to advance food safety, and we're doing that, state and feds. There's a lot industry can do to advance food safety, and I know a lot in the private sector are continuing steadfast in their work. but there's so much more that we can do together. I believe that in this 21st century, we're going to have to redefine collaboration. To me, this idea of collaboration in the last century was people coming around at a table, benchmarking, sharing best practices, and telling stories. But that's a very old view or paradigm of collaboration for the 21st century. Like I said, we're living in the data age. The 21st century is increasingly going to be about data sharing, working together as we've been doing for so many years, and increasingly sharing data. We're all going to get smarter together. So thank you again, AFTO members, for your partnership as we face the challenge and opportunities that lie ahead together and ultimately improve consumers' lives. Thank you very much.